Hello, I'm Dr. Khalilah Jefferson, DNP. Today I want to discuss a leadership concept that has a direct and measurable impact on patient care: psychological safety in nursing teams. Psychological safety refers to a team environment where individuals feel safe to speak up, ask questions, report concerns, and admit mistakes without fear of embarrassment, punishment, or retaliation. In healthcare, this is not a soft concept. It is a patient safety issue. Research consistently shows that teams with high psychological safety have better communication, fewer preventable errors, and stronger clinical outcomes. In nursing, psychological safety influences whether a nurse feels comfortable questioning an order, escalating a concern, or asking for help when something does not seem right. When psychological safety is low, nurses may stay silent. That silence can delay care, allow errors to progress, and increase risk to patients. One important misconception is that psychological safety means lowering standards or avoiding accountability. That is not the case. High psychological safety exists alongside high expectations. Strong teams hold one another accountable while maintaining respect and trust. Leadership behavior is the primary driver of psychological safety. Nurse leaders shape psychological safety through everyday actions: how they respond to questions, how they handle mistakes, and how they communicate during high-stress situations. When leaders respond to concerns with defensiveness, dismissal, or blame, staff quickly learn that speaking up is unsafe. When leaders respond with curiosity, support, and problem-solving, staff learn that their voice matters. Another key factor is how errors are addressed. In psychologically safe environments, errors are examined to understand system breakdowns rather than to assign individual blame. This approach supports learning and reduces the likelihood of repeated mistakes. Psychological safety is also closely linked to nurse retention and burnout. Nurses who feel unheard or unsupported are more likely to disengage, experience moral distress, and leave the profession. Conversely, teams with high psychological safety report stronger morale, collaboration, and resilience. For nurse leaders, building psychological safety requires intentional effort. This includes encouraging questions and input, responding calmly to uncertainty, acknowledging limitations, modeling respectful communication, addressing disrespectful behavior consistently. Importantly, psychological safety must be maintained even during pressure, staffing shortages, and emergencies. In these moments, leadership behavior matters most. The connection between psychological safety and patient outcomes is clear. When nurses feel safe to speak up, patients are safer. This video is for educational purposes and leadership awareness. It is not medical or professional advice. Understanding psychological safety helps nurse leaders create environments where high-quality care can consistently occur. Thank you for listening.